Olmesartan is a medication that is used to reduce blood pressure. It is an angiotensin II receptor blocker, commonly known as an ARB. It is available as a tablet and popular under the brand name Benicar. This video covers the important information about olmesartan, like how it works and what important precautions should be considered, how to take this medication, and what are the common side effects. How does it work? Olmesartan helps in reducing your blood pressure by blocking the renin-angiotensin system. RAS plays a key role in the constriction of arteries and elevating your blood pressure. It also influences sodium levels in the body by controlling its excretion. Olmesartan is classified as an angiotensin II receptor blocker. It acts on the renin-angiotensin system and inhibits the actions of angiotensin II. Angiotensin II is one of the important mediators within this renin-angiotensin system. It has several roles in the body, including its direct action on the blood vessels. Blood vessels are expressed with angiotensin II receptors. Angiotensin II can bind to these receptors, resulting in their activation. Consequently, it produces contractions of your arteries and increases the blood pressure. Olmesartan selectively blocks these receptors. It acts as an antagonist at these receptors, preventing the binding of angiotensin II. It prevents contraction of arteries, leading to lowering of your blood pressure. In addition, olmesartan also blocks other actions of angiotensin II. Normally, angiotensin II can increase the secretion of a hormone called aldosterone. This hormone increases the absorption of sodium into the blood from the filtrate in the renal tubules. This increases sodium levels in the blood, which further increases body volume. It finally results in elevation in your blood pressure. Olmesartan controls aldosterone levels in your body, blocking the actions of angiotensin II. Olmesartan also blocks hypertrophy produced by this mediator. Hypertrophy results in increased thickness of renal arteries and cardiac muscle, leading to loss of their function. On continuous use, olmesartan can also control this hypertrophy. How to take? Olmesartan is available as tablets, and you can get them in 3 strengths such as 5 mg, 20 mg, and 40 mg. The right dose of olmesartan depends on many factors, like your age, purpose of use, renal function, and other medications co-administered. You may be given olmesartan either alone or with other blood pressure-lowering medications. Therefore, the dose of olmesartan may be low when it is combined with diuretics. For treating hypertension, olmesartan can be started at a typical dose of 20 mg, given once a day. However, after 2 weeks, based on the clinical response, the dose may be increased to 40 mg per day. Olmesartan may produce significant hypotension at higher doses. Therefore, it should always be started at a low dose initially. The hypotensive effect may be observed at normal doses if you have low body volume or if you're using diuretics. Thiazides can increase urinary excretion and produce loss of body volume. This may help in reducing your blood pressure. That's why they may be combined with olmesartan for producing better control of blood pressure. Amlodipine is a calcium channel blocker that can be combined with olmesartan. However, when they are used at higher doses, they produce very significant hypotension. Angioedema. Olmesartan can produce a condition called angioedema. It may occur at any time during treatment, especially after the first dose. The risk may be increased if you have any previous history of angioedema. A family history of angioedema can also be a risk factor. This results in the swelling of your face, tongue, and lips. You may have difficulty breathing and difficulty swallowing. You should use olmesartan carefully if you experienced angioedema with the use of ACE inhibitors. Prolonged monitoring of air pathways may be required while using this medication in people with a risk of angioedema. In case of developing angioedema, an intramuscular administration of epinephrine may be required. Effect on kidneys. Olmesartan may produce impairment of your kidney function. It may produce acute renal failure. Since olmesartan is going to inhibit the renin-angiotensin system, this medication should be carefully given to people where the functioning of this system is highly essential. It is more important in people with renal artery stenosis. It is a condition of narrowing of renal arteries that results in low renal blood flow. In such people, glomerular filtration rate is dependent on efferent arteriolar vasoconstriction, which is mediated by angiotensin II. Using olmesartan in renal artery stenosis may further impair glomerular filtration rate. It may result in acute renal failure oliguria, and azotemia. In case of significant deterioration in renal function, this medication should be discontinued. In patients with pre-existing renal insufficiency, this medication should be carefully used. In people with unstented bilateral renal artery stenosis, olmesartan should be avoided due to the elevated risk of deterioration in renal function. In people with heart failure, again, renal function may be reduced with the use of olmesartan. Hypotension. Olmesartan reduces your blood pressure. However, a significant reduction of blood pressure may result in the risk of hypotension. Especially in patients with volume or salt depletion, this effect may be more pronounced. ACE inhibitors should not be combined with angiotensin receptor blockers like olmesartan, because this may produce a dual blockade of renin in the angiotensin system that results in syncope, hyperkalemia, and acute renal failure. Combining olmesartan with aliskiren is associated with increased risk of hypotension. Therefore, it should be avoided. Olmesartan should be carefully used in people with salt restriction or prolonged diuretic treatment. It should be started at a lower dose in such people. In children of age below 1 year, olmesartan is not recommended. Since it acts directly on the renin-angiotensin-aldosterone system, it can have adverse effects on the development of immature kidneys. Olmesartan should be used carefully in congestive heart failure or during surgery or anesthesia. Hyperkalemia. Olmesartan can increase your potassium levels. This is because of its action on the renal system. Monitor your serum electrolytes if you suspect symptoms of hyperkalemia. The risk may be more enhanced if you have coexisting risk factors like diabetes or renal dysfunction. A high potassium level may be fatal, and it can produce few symptoms that resemble a problem in your heart. You may have chest pain, difficulty breathing, nausea, vomiting, and irregular and pounding heartbeats. It can also produce muscle weakness, loss of sensation, and tingling sensation in the arms and legs. Abdominal pain, diarrhea, and even sudden collapse may be observed with high levels of potassium. Therefore, carefully monitor for the symptoms of hyperkalemia. If you observe any hyperkalemia, discontinue the treatment or reduce the dose. Normally, angiotensin II is responsible for the secretion of a hormone called aldosterone. This hormone can increase the absorption of sodium into the body from the renal tubules. But when the angiotensin II actions are blocked, aldosterone is not secreted, which results in the increased excretion of sodium. When sodium is excreted, potassium is more retained in the body, leading to higher levels of serum potassium. The potassium levels can also be elevated by many of the other factors, particularly when you're taking over-the-counter medicines, vitamins or minerals, or even herbal products. They may increase the potassium levels in your body. Therefore, while taking olmesartan, carefully monitor these medications. If you are taking potassium supplements, they can increase the risk of hyperkalemia. Intestinal problems. Olmesartan can induce a few intestinal problems. You may have severe, chronic diarrhea. It may also result in substantial weight loss. In such conditions, you should discontinue use of olmesartan, and other alternative antihypertensive agents may be used. Use in pregnancy. Olmesartan can produce damage to the fetus. It can produce a condition called oligohydramnios, where amniotic fluid is reduced, which causes damage to the fetus. Therefore, it is not recommended in pregnancy, particularly in the second and third trimesters. It can reduce the fetal renal function and increase the risk of fatal damage. Therefore, try to avoid this indication when you become pregnant. Side effects. Many of the side effects of olmesartan are mild and well tolerated. You may experience dizziness, headaches, and lightheadedness. Your blood glucose levels and lipid levels may be elevated. Nausea, vomiting, and diarrhea are also observed. It can also produce pain in the joints and muscles. Few people may have cold-like symptoms, sinusitis, and pharyngitis. Back pain and bronchitis are also noted. Olmesartan may cause hypersensitive reactions that may result in angioedema, leading to swelling of the face, tongue, and lips. These are the important things that you should know about this medication before its use. Share your experience and how it works for you in the comment section below. Thanks for watching this video. Have a great day.